this for? Okay, so do I introduce Mark then? Yeah, I mean, I was just...
Hey, Jonathan, you hear this? Okay, got it? You there, man? Did you get it at all? You got it? You got it yet? Check, 1, 2. Okay.
Good morning, everyone. Good morning. Thank you for joining us today. I'm Eileen Cantor, the Administrator of Marketing, Community, and Public Relations at Hurley Medical Center. Joining us now is Dr. Mona Hanna Atisha. She's the Director of the Pediatric Residency Program at Hurley Children's Hospital and Assistant Professor of Pediatrics at Michigan State University College of Human Medicine.
Hi, everyone. How's everybody doing? Good. It's great to see so many faces here and to see so many members of our community who are committed to children and committed to the city and the future of the city. So we are here today to announce something that is super exciting, something that really hasn't been done before, and something that we have to do now. It is the announcement of a pediatric public health initiative. And what that is, it is the bringing together of great minds from Michigan State University, from Hurley Children's Hospital, from all members of our community to make the future of our children even brighter than it could ever have been. We are bringing in a team of experts in epidemiology, in environmental health, in research, in pediatrics, in child development, in pediatric psychology, in geography, in education, in almost every discipline that touches children to ensure that this population-wide exposure does not limit their life course trajectory. And we are in the right place at the right time. So Michigan State has had their public health programming here. Michigan State has long time been in the Flint community. They have the infrastructure. I was a MSU medical student here in Flint about 20 years ago. Hurley has been here forever, over 100 years. Hurley has been in the community with a mission of serving the community. So it is the perfect time with the perfect people. So we can sit back and in 10, 15 years and we can do nothing and we can see the consequences of this population-wide lead exposure. We can see a community suffering from the cognitive, the behavioral ramifications of this population-wide lead exposure. We can just sit back and research that and say, oh, look at this. Here's another community that has been affected by this exposure. Or we could do something. And this is our opportunity to do something. This is our opportunity to build something that's never been built before. And I see it as a model public health program where we bring in these experts to do three things. One is to continue to assess, so to continue to do the research that we've already started, that we have ongoing, to look at the extent of this exposure, to continue to monitor these children for a long time to see what's going to happen to them. But our goal is that we see nothing. Our goal is for that third piece, the intervention. We hope to recommend and to develop and advocate for interventions so that we don't see any consequences of this lead poisoning. Can you imagine that in 10, 20 years, our children in Flint may have a brighter future than they ever had? And that is absolutely the goal. And that is our obligation, and that is my duty as a pediatrician. My job is every day to take care of that kid in front of me. But more importantly, my job is to make sure that those kids have the brightest future ahead of them. And this is a commitment to our kids. So thank you for being here. I'm super excited about this opportunity. It bridges my life as a pediatrician with an MPH with a background in environmental health. This is kind of my dream. So I can't imagine working with more competent people and having the support that I have from Hurley and from MSU to do this. At this time, I would like to introduce Dr. Dean Sanko, who is our Associate Dean at MSU for Prevention and Public Health. Dean.
She's a hugger, so you don't know her yet. Yeah. Good morning, everyone. Thank you for joining us here today. I'm Dean Sanko, as you heard, Associate Dean for Prevention and Public Health at the Michigan State University College of Human Medicine. I also direct our Division of Public Health, which is headquartered here in Flint. The Division of Public Health will provide administrative and technical assistance to Dr. Hannah Atisha's efforts to study the short and long-term effects of the lead-contaminated water exposure, particularly among children in Flint. We will help to organize and staff the Pediatric Public Health Initiative. In this regard, I personally reached out to Mr. Mark Valachek at the Genesee County Health Department and Dr. Eden Wells of the Michigan Department of Health and Human Services to join us in this effort. It is critical that we have a partnership with many in this community, and in particular, governmental public health agencies. Dr. Hannah Atisha will lead the Pediatric Public Health Initiative. We will help her establish and conduct her studies with multiple MSU faculty experts. Among those identified are experts in environmental health, epidemiology, pediatrics, perinatal health, developmental assessment, toxicology, nutrition, and medical geography. And speaking of medical geography, I want to recognize one of our faculty from the Division of Public Health, Dr. Rick Sadler, there he is in the back there. Dr. Sadler conducted the geomapping of the lead-burdened children in Flint, which helped us to understand where the problem was most concentrated. Dr. Sadler joined Dr. Hannah Atisha as a co-author on her study that was recently published in the American Journal of Public Health. Our growing presence in Flint is intended to be of service to the public health needs of the people in this community. The Pediatric Public Health Initiative offers a vehicle to have the research talents of Michigan State University address this ongoing public health concern. And with that, I'd like to introduce Mr. Mark Valachek, Director and Health Officer of the Genesee County Health Department.
Thank you. As the Director of the County Health Department, we're really pleased to be a partner on this initiative. So much more can be accomplished when you work in partnership with others, and this is a precedent-setting event in terms of what has happened to this community and in terms of what we're trying to do to not only intervene, but to prevent it from happening anywhere else in the world. We have an opportunity to demonstrate what we can do as a community to intervene, to prevent the damage that could occur as a result of the exposures that happened in this community. And I think that we could be most effective by assuring that we've got good partnerships, that we connect individuals, that we're communicating the same messages to our community so that they can build trust in the work that we need to do going forward to solve the problems that have been created as a result of what happened here. So I'm very excited about this partnership. As an academic health department, we have longstanding relationships with both MSU, U of M, and a dozen other universities actually around the country. So I think it's an opportunity for us to really be on the cutting edge of protecting the public health of Flint and Genesee County. So thank you very much.
Good morning, everybody. I'm Eden Wells. I'm the Chief Medical Executive for the Michigan Department of Health and Human Services. Thank you, Mark. I think that, as governmental health officials, we work very hard to apply the public health programs, protect the people's health. In this unprecedented situation, we have the opportunity and, frankly, the startup from the research and the studies that Dr. Mona Hanna-Attisha began last fall to work together, united, academia, physicians, providers in the community, providers around the world, experts across governmental agencies. All people can come together to bring the maximal resources to support the work of the collaborative that Dr. Mona Hanna-Attisha will be leading on behalf of the Michigan State University College of Medicine. The Department of Health and Human Services, I'm here. It's interesting, I had a call last night, and I want to say that our director, Nick Lyon, extends his regards. It's a full support for the work that Dr. Hanna-Attisha has done and for this collaborative. And he was very happy to hear about this event this morning. We at the department will continue to work with providing the data. There's been a couple data use agreements and scientific memoranda that have been established with Dr. Hanna-Attisha's group and the department for access to any of the data that is necessary. And it may be from many different departments and that will help to provide this. She has a lot of resources at hand, but we need to provide as much of the public health data to her. And that's a long-term issue, because this is a long-term response. I think we all envision, when public health events like this happen, we all envision that things will be better. This is one of the ways, one of the huge steps that will happen to make things better, because in this collaborative effort, you can bring to bear all of the potential resources, federal, state, local, academia, private sector, to envision that perfect world, right? That great world where the children will have not only mitigated the issues of the issue or of the event at hand, but to live a better life, to have a bright future, and that this would be an infrastructure that persists in perpetuity. So I want to thank you for the opportunity. We support this effort 100%, and congratulations.
Hello, I'm Aaron Souza. I'm the Interim Dean for the College of Human Medicine. I want to welcome you all to the college and to Michigan State University, and thank you for coming. Michigan State University has been in Flint for 100 years. The College of Human Medicine has been training medical students and had faculty in Flint for 40. And we have had more than 1,000 students now complete their training in Flint. We have hundreds of faculty, including Dr. Mona Hanna-Attisha, who have worked with the college and the community for many, many years. We are proud to be here. And over the last 4 or 5 years, we have expanded our presence in the community. We've done that through partnership with Hurley, with McLaren, with Genesis, and with the C.S. Mott Foundation. So you are in this building because of the partnerships over the last 5 or 6 years with those hospitals and the C.S. Mott Foundation. And the development of the public health division comes directly out of that work. So we would not have people like Rick Sadler if it wasn't for the support of the C.S. Mott Foundation. There are other parts of the university who work intimately in this community as well. MSU Extension has been here for 100 years, and you have already seen some of their work in response to the exposure to lead, including work on nutrition at the farmers market, work with early childhood education. The College of Education is here as well, also through the support of the C.S. Mott Foundation. They have 20 people working with the Flint schools. There's work in pre-K, there's work in establishing community schools models, which help with the delivery of services to children who have been affected by their exposure to lead. This is an important time for this community. And that is one of the reasons that the state has invested in land-grant institutions. Michigan State University is the pioneer land-grant institution. And the College of Human Medicine is the pioneer community-based medical school. We work best when we work in a community. And we exist to help the people of communities, whether they are children, whether they are old people. We are all about making the lives of people healthier, making their family life better, and making their community a safer and better place to live. This is exactly why we have been in this community for decades. It is exactly why we are here now, and it is exactly why we will continue to work on this through the future. So we are immensely proud to be a part of Flint. Flint has wonderful, thoughtful, intelligent, resilient people, and it is an honor to partner with them. And I want to thank you for coming today to help us celebrate this new initiative that I am confident will make a huge difference in the lives of children and their parents and the community. So thank you very much.
Thank you all for taking the time to join us today. One-on-one interviews are now available with the speakers. Please help yourself to refreshments and have a wonderful day. Thank you.